Hi, I'm Nick. This is Sam. We're clinicians here at Complete Physical Therapy, and we're going to show you how you can use a power band to assist in hip mobility. She's going to go ahead and get things set up here so you can see how the setup looks. She's going to have this band crossing her body to her right leg. So the band starts over the left shoulder and goes to the right leg. Once she's laying flat, most likely on the ground, she's going to work on a mobilization technique where she's tightening her quad, straightening her leg, which is what we call reciprocal inhibition. When she tightens the quad muscle, it helps inhibit the hamstring muscle, making it a little easier to stretch. We start at a low angle. As things loosen up, she's going to change her hip angle so it is at a greater angle, getting a greater pull. As we get closer to that maximal angle, she can tighten and then pull the whole leg back a little bit. And she'll feel a stretch in the calf hamstring. The other thing that we can get is a neural glide here. She starts to pump the toe. Same thing. She's going to get a good calf stretch, but also a neural stretch and change in that mobility of the neural structures in the posterior side of her thigh. The other thing we can work on is mobilization stretching of her adductors and abductors. When she does this, she's going to just move this foot out to stretch her adductors, and then she'll move her foot inward to stretch her abductors or IT band. This again can, if she needs to, turn it into more of a static stretch. In this case, we're using it more as a mobilization activity. Once she's worked through that, we can also work deeper into hip stretching. We can do a knee to chest assistance where she is pulling, trying to get this knee up, either up out into the armpit area in regards to stretching that deep hip, or coming across in that direction. Once again, she can use this band to help her get that deep stretch. If we're doing short lever rotations, we can once again put her ankle here. She can push and stretch to get rotation of the hip socket. She can also pull and assist on an internal rotation of the hip socket. Once again, getting deeper into that hip socket with her stretching. The other thing that we could do is a long lever rotational stretch where the leg is straight and she's going to turn her hip out and turn her hip in. All of these can greatly improve the hip mobility and decrease hip pain.